20 years ago, we opened our doors to the businesses and individuals of Northwest Georgia. So much about health insurance has changed over the last few years, but a few core things have not. Our members are the reason we're here, and we strive daily to serve you well.
How can I help you today?
We want to thank our members for choosing us each year as their health plan. Tens of thousands of you chose Alliant this year. We don't take that choice or that trust lightly. We're Alliant, and we're here for you.
Well, hi everyone, and thank you for being with us today. We're going to be discussing what you need to know after your enrollment for health insurance. You have now found a plan and enrolled for 2018, but what are some things you need to know when using your insurance coverage? Angie Fussell from Alliant Health Plans is here today to answer some of these important questions. And Angie, thank you so much again for staying with us and answering additional questions that we might have about our health insurance.
Well, thanks for having me again.
You know, all right, so we've taken it from, okay, we've now have found our coverage that we want to enroll in. We've enrolled, we're ready to start the year. What is the next step after enrolling in our health plan?
Well, first, let's just remind everybody that the deadline for enrollment is December 15th.
That's right.
I don't want anybody to forget that. But once they've completed that enrollment process, they're going to need to make their first month's premium payment. And we call that the effectuating payment. And that payment is due the last day before the first day of your coverage. So before December 31st, you need to make that first month's premium payment. Once we receive that payment, you're going to receive your ID cards, and you're going to receive a short booklet that just kind of gives you the basics of your healthcare coverage and how to use it for the year.
Right.
But again, don't wait until the last minute. You're going to want those materials. You're going to want the ID cards. You're going to want that booklet of information. So it is very, very important that you don't wait until the last minute to pay that effectuating payment.
Because you might have a need to be at a doctor's office January 2 or 3, and you may not have your information.
That's right. That's right. And you don't want to miss that deadline for paying that first month's premium either.
All right, so I'm hearing you say, so you enroll, but that doesn't mean anything unless you make that payment first.
That's right. That's right. If you wait and you don't make that payment by December 31st, you don't have health care insurance for 2018.
Even though you enrolled?
Even though you enrolled. If you don't make that first payment by December 31st, you will not have active health care insurance.
Very interesting. Okay, well, that's very important to know. Sometimes I think there's a lot going on and we forget to make the payment, let's say through the year. You know, sometimes it's hard to find the time to sit down and make your payment out for your insurance along with everything else you have to do. There's some ways it can be much easier for us. Tell me a little bit about that.
There are. You know, we try to make it easy and we try to provide lots of options for paying your monthly premiums. We want to stress our auto pay first and foremost because that does take you having to think about it every month. And auto pay is simply where you sign up to have that monthly premium payment deducted from your checking account on a monthly basis. It's very easy to enroll. You can call customer service and they can help you enroll. Or you can download the auto pay enroll form from our website at alliantplans.com.
Right, and believe me, that is the easiest.
It is the easiest way. Of course, you can call customer service and you can make payments, but that is the easiest way. Because you don't want to lose your health care. You know, if you don't make that monthly payment, you will lose your coverage.
Right. I found that to be the easiest for me. The first couple of months, I'd write a check, and I'm like, this is no fun. I just get it deducted. It makes it so much easier. Then you don't have to worry about it.
And we're not used to paying bills that way anymore.
Right.
So,
and you don't have to worry about it because you know your insurance is always there.
Right.
It's been paid. It's paid every month, and you don't have to worry about that.
Right. So just a reminder that first premium, that monthly premium, has to be paid by December 31st. I can't stress that enough.
Right. Because again, if you have a doctor's appointment January 1, 2, 3, and you haven't made those payments,
that's right.
Good luck.
That's right.
You want to have insurance. Let's talk about providers because that's one thing a lot of people need to know as well. Once you made your first payment, say you have your ID card, you're going to your doctor, how how do you find your doctor actually before after you get your enrollment and you're looking, we wonder what do I do next? How do you find it?
That's a great question. First, we want to direct you to our website because we have a fantastic user-friendly provider search feature. So you can search for in-network providers that way, or you can call customer service and they'll be happy to help you find a provider. When I use the term in-network, I mean a provider who has a contract with Alliant. When you use an in-network provider, that does reduce the cost. There is a cost savings for the member when you use that in-network Alliant provider. If you choose to use an out-of-network provider, you can, but your out-of-payment pockets are probably going to be a little higher if you use an out-of-network. Now, Alliant has a broad network of providers in Georgia, especially in North Georgia, and even parts of southern Tennessee. So you're going to find it. I think most people are going to find an in-network provider that will suit their needs. Again, they can call customer service and they can help them find one.
Right, and I guess my question would be, if I'm listening to you say this, why would you not try to find an in-network doctor?
I agree with you. There could be a specialty here or there,
maybe so.
But for the most part, like I said, we have a very rich network, and chances are you're going to find what you need.
Yeah, that's great. That's important. Do you have to have a referral from your to see a specialist? Let's just say, if I wanted to see a specialist, do I have to get someone to refer me my physician?
Good news, no.
No.
You don't have to have a referral.
That is maybe a misconception a lot of people have thought.
It is. You do not. Again, though, I suggest if you're going to go to a specialist or to a different facility or hospital that you do make sure they're in network to reduce your out-of-pocket costs.
Yeah, that would be a very important step to make, I think, if you're going to be needing to see a specialist. Tell me a little bit about what do I need to have, if I say I'm going to have a procedure, do I need to have it approved first from Alliant, or how does that work?
In some cases, you do need what we call a prior authorization for Alliant to pay for a procedure that you might need. That's very simple. There's a list of those procedures that require prior authorizations on our website. You can find that there. If you use an in-network provider, they'll take care of that for you. So that's another benefit of using an in-network provider. If you choose to use an out-of-network provider, and that procedure requires a prior authorization, you're going to be required to obtain that. And you can do that by calling customer service. And there's also steps outlined in your certificate of coverage. So while not all procedures will require prior authorizations, you do need to check to make sure in case it does.
So if you use in-network, it's taken care of through.
Yes.
But if you do not, you're kind of responsible in taking your paperwork up there as well, or wherever you go?
Yeah, you'll have to call. You'll have to get that. And the prior authorization will be handled through Alliant Health plans, but you will be responsible for obtaining that prior authorization number for that out-of-network provider.
Oh, I see. Okay. There's a lot of resources to make it easier to understand. I know you mentioned that you can go online and look at Alliant Health Plan's website. It kind of describes a lot of information about Alliant. Speaking of that, let's talk a little bit about Alliant Health Plans. We did that a little bit earlier in another interview, but a lot of people, hear the name but really don't know a lot about Alliant Health Plans. Let's talk a little bit about that.
A lot of people don't realize that Alliant Health Plans is local. We're based here in Dalton, Georgia. We have plans on the healthcare marketplace. Some people call it the exchange or healthcare.gov. In 24 counties, all in North Georgia. And again, we have a rich in-network, a network of in-network providers that we think will meet everybody's needs. But again, we're local, and a lot of people really like to hear that.
Right. You're local, but you have a lot of coverage.
We do.
And a lot of, you have a lot of in-network physicians. I mean, what else can you ask for?
That's right, and hospitals.
Right, and that's so important.
It is.
Well, our time is almost up. What would you like our audience to take away from our discussion today?
I think there's a few things. First and foremost, you need to make that effectuating payment, that first month's premium payment by December 31st. Because if it's not made, you will not have effective health insurance coverage next year. Secondly, again, it's premiums. Make sure those monthly premium payments are made on time every month. We try to make that easy as possible for you with our auto pay. Again, you can call customer service or download the enrollment form from our website.
Okay, great. Well, thank you so much for your time and helping us walk through the stages of health insurance. Thank you so much again.
Thank you.
20 years ago, we opened our doors to the businesses and individuals of Northwest Georgia. So much about health insurance has changed over the last few years, but a few core things have not. Our members are the reason we're here, and we strive daily to serve you well.
How can I help you today?
We want to thank our members for choosing us each year as their health plan. Tens of thousands of you chose Alliant this year. We don't take that choice or that trust lightly. We're Alliant, and we're here for you.
I am from Dalton, Georgia, and I love working for Alliant. I mean, Alliant strives to do good things in our members' lives and also in the lives of our community.
At Alliant Health Plans, we want to focus on obtaining the highest quality of care for our provider network. And in doing that, our criteria for our physicians and our nurse practitioners, our facilities to come in network, adheres not only to the national standards, but we also go above and beyond that.
When you're healthy, it almost doesn't matter who the ownership is of your health plan, but when you get sick, it sort of matters that physicians and hospitals own the health plan, because at the center of the decision making, right, is how do we best deliver care.
I think it's important being a provider-owned entity because they look at this from more of a global perspective with the patient in mind in all things. This is not about this quarter's earnings. This is about a community, improving the health of that community.